This morning, Washington State remains the center of attention as the coronavirus spreads quickly. All of the deaths so far involve elderly patients or patients with underlying health issues, most linked to a Seattle area senior center. While in New York, experts warn the virus will spread there after a healthcare worker contracted the virus, likely during a trip to Iran. She's now quarantined at home and does not need hospital care. In Miami, the school district is already preparing 250,000 laptops and tablets for students to work from home in case schools are closed.
This is not the time for parents or teachers or students to be concerned with perfect attendance. If you're sick, don't come to school.
President Trump on Monday met with drug company CEOs.
When do you think you could have the vaccine?
Pushing them to quickly develop a vaccine while seeming to contradict a timeline offered by Dr. Anthony Fauci, the nation's top virus control expert.
Do you accept that this will take longer, probably, than you would like?
I don't know what the time will be. I don't think they know what the time will be. I've heard very quick numbers, a matter of months, and I've heard pretty much a year would be an outside number.
He's asking the question, when is it going to be deployable? And that is going to be at the earliest a year to a year and a half, no matter how fast you go.
Meanwhile, in Denver, no coronavirus cases yet at National Jewish Health. But over the weekend, someone came into the hospital and stole protective masks meant for doctors, nurses, and patients. With supplies running low nationwide, the hospital is now guarding its supply while it awaits another delivery.
There is a huge public frenzy right now for buying masks, and all of us in the healthcare world have urged the public to stop buying masks.
Okay, so Tom, we mentioned the high-fiving and the NBA going away for a bit. There's also a bit of discussion about handshaking and kissing as well. What's the word there?
Yeah. Listen, a lot of doctors are saying that it probably is a good idea right now to cut back on handshaking, on casual hugs and kisses and that kind of thing for now until this literally kind of spreads out and diminishes. And the bottom line on these masks, we've said it before, it's worth repeating, especially as that one hospital reported that somebody had come in and taken a bunch of masks. These are really not effective for you and me if we're out in an airport, for example, or in a public setting trying not to get sick. That's not what these are for. They're for you to prevent from spreading the disease yourself. If you have the flu or if you have coronavirus, you don't want to give it to somebody else. But as a protective measure, really not that effective.